I'm going to educate you guys a little bit about what the laser has to offer and how it can take your practice to the next level. So this LEM laser is sets apart and is different from the other lasers that you know. Main reason being is there's two wavelengths in one machine. So it has the ND-YAG and the erbium-YAG. The ND-YAG is targeting blood and pigment, and then it's giving you a deeper penetration. The erbium-YAG is looking for water, so it's going to be a more shallower penetration. Just to show you that if you switch to a laser, you're not going to lose the speed that you would get with a normal handpiece and drill. You still have that same speed. This video is showing that you can cut right through a tooth within about 22 seconds. So you're not losing any of that speed that you would get from a regular burr. Couple other aspects you can use when using the laser. You can treat herpetic lesions or alpha ulcers. With the ND-YAG, you're going to use to kill the actual virus, and then you're going to follow it up with the erbium bandage with the erbium side. What that's going to do is help promote healing, faster healing, and reduce as much post-op pain. You can easily treat hemangiomas. And you can see ROI on a lot of these on a lot of my slides. It's just going to show. One of the things I like to tell the doctors is if you're referring things out that you can normally keep in your practice, that's one of the biggest implements for the laser. So keep in-house what you can keep in-house and even add additional treatments. So I'm not sure how many are actually treating hemangiomas now. It's not really a more common thing unless you have the equipment to do that. Fibroma removal with the laser, the ROI with that is anywhere from about $400 to $600. Very easy, fast treatment, easy healing time with the laser versus having to remove it with a 15 or a scalpel. Gingival pigmentation, or as you guys may know it as gingival bleaching. This particular case the doctor did actually in Miami, and he just used a little bit of topical on each arch. About 30-minute treatment, and he charged about $1,400 per arch to do that. Buccal frenectomies with just a little bit of topical, I've seen it both ways. It kind of depends on the patient, but I've seen it with topical. Obviously, if it's a little bit thicker or maybe a child, you may have to numb up for it, but I've seen it several times done with just topical. Great, less post-op pain. Again, you're able to get the ROI with it. If it's not something that you would normally do, I have a short video here to show you exactly how it's done. So you're going to use the erbium side to actually release that attachment, and then you'll follow it up with the ND-YAG side to get that hemostasis and help reduce bleeding, help reduce post-op pain, any of those things. Also, when you are looking at frenectomies, it is studies are showing that tongue ties are actually linked to obstructive sleep apnea. So if you guys are incorporating or starting to kind of get into sleep, definitely look at your patients. Look for that lingual tongue tie and release. Let's see if I can skip. Gingival recontouring is another fast, easy ROI for that is about $600 per quad. It's a great additional service for you to add for your patients. Crown lengthening, whether it be soft or hard tissue. Again, the post-op for these are far less when you're using a laser. One of the main reasons is photobiomodulation, which we'll get into later on. But what that's doing is actually helping your body repair from the inside. And it's promoting faster healing, and it's less post-op pain for your patients. Perio, treating perio with the laser is another huge benefit. This you can see the growth that came back with this particular case, 9 months post-op. You're using both sides of the wavelengths for the perio. So you're going to use the ND-YAG side to remove any of the diseased tissue. And then you're going to use the erbium side to clean out any of the calculus debris in there along the root surface. And then you'll follow it up with the ND-YAG side to give you that fibrin clot and have the growth factors in there. Implant recovery is great with the laser versus your scalpel. So basically, again, like I said, less post-op pain. You have less inflammation, less bleeding, and you can see the difference between using the scalpel versus your laser. So a lot of times it can result in immediate placement if you're able to, versus having to wait for healing time, wait for the bleeding to stop. Peri-implantitis is huge with the laser, and I'll just actually show the quick video here. Is it playing? Nope. 1 second. There we go. So this is really cool, actually. It's the erbium side of the laser is not reactive with your titanium, with any of your implants, zirconia, titanium. It's just basically erasing. It's erasing any of the, if you follow that, the green beam, it's just erasing all of the buildup on there, cement, anything like that. So it's helping to save those implants versus losing them. This is just showing that it's safe on zirconia as well. So you're able to uncover the implant. If you have tissue that grows over, you can uncover it and then go ahead and take an impression, place the abutment, take an impression same day, versus having to have the patient back. You can see it right there through the mirror, uncovering that tissue. So very cool feature. Peri and endo combined, I mean, clinically, I would kind of look at this x-ray and think that might need to be extracted, but obviously I'm not the dentist, but if you're able to do the endo treatment, do the perio treatment, and save the tooth, you're saving what looks to be a 3 or 4 unit bridge for that patient. This is Dr. Myron. I don't know if you guys are familiar with him. He's one of the leading research experts with PRF. He uses the laser along with PRF as well with all of his facial aesthetics. If you guys haven't heard about him, definitely research him and look at everything he's doing. Very cool stuff. So using it with pediatrics too, like I said earlier, is great. It's conservative, fast, many times can be anesthetic free. I don't know why that's not playing. So these are those hard to reach areas. With the laser, you're able to avoid having the burr that's going really fast, damage any of the tissue right there where you would normally have to reach in order to get to the rest of the decay. So you're able to do the prep without or with very minimal bleeding, and it also coagulates, gives you that hemostasis as well, so you don't have a ton of bleeding, so it's still visible to see. Along with that, you're going to improve the bond strength. So you remove the smear layer for a better bond strength. You can also desensitize as well with the laser prior to crown placement, fillings, anything of that nature. Desensitizing your preps, you can do pulp caps, whether it be direct or indirect. If you're doing a direct pulp cap, you're going to use the Indiag side to actually stop the bleeding, that little pinpoint bleeding, and then you'll use the erbium side to place what's called an erbium bandage over top of the pulp. What it's doing is it's creating a bunch of scrub bubbles in and out the tooth. This is actually an animated model that's showing how it works, but it's a photoacoustic effect that goes in and out of all the chambers, all your lateral canals, your 90-degree turns, goes all the way to the apex to clean out all of the nerve tissue. Post removal, this is actually one of my favorite videos, and I'll let it play through all the way. But how many, I mean, she just talked about a patient coming in with a crown off, you know, it's broken off at the gum line. In this case, you're able to actually remove the post with the laser. So if you look down towards the cotton roll, you'll actually see it wiggle out when it's in slow motion. But when you're using the laser, you're going to put that tip in there, and what it's doing is basically melting away any of the cement or bonding agent that has, it's in slow-mo right now, so you'll see it come out. So it's getting rid of that cement that bonds the post in place. And these are just some before and after pictures showing the results, showing all of the lateral canals, any accessory points that it would reach that you can't normally get with your traditional endo. One of the coolest features is removing crowns and veneers. in seconds. So how many times have you tried to cut off a zirconia crown and you've gone through 5 burrs to try to get one off? So this way you can eliminate having to damage your burrs, and you can use the laser to remove the crown. All porcelain crowns, so whether it be zirconia, Emax. This is if you don't want to save the tooth, the crown. If you decide you do want to save the crown, you can actually remove it intact. I didn't know there was sound. So you're just doing a painting stroke over the whole surface, and it's a different setting if you decide you want to keep the crown. So you're going over all of the surfaces, and then the veneer or crown comes off, and you're still able to save it if need be. So very cool feature. We have doctors that, how many times you put a crown on and then the patient's sensitive, you have to go through the crown to do the root canal or something of that nature. You can take the crown off, do the root canal, put the crown back on, so you're not damaging the bond strength from the crown. So very cool feature. I had a doctor that the patient wanted to reshade them, the front 6. So they took them all off, sent them to the lab, reshaded them, put them back on versus cutting them off and remaking them. Photobiomodulation, which is what I kind of touched on just a minute ago, but this is helping you treat, it's lower level laser light therapy, and it's treating any kind of pain. So it's penetrating deep into the tissue, the muscle, the nerve, and it's helping to repair. So adding this to your practice, it's fast, it's easy, it's beneficial for the patient. Actually, a lot of the doctors and staff end up using it on their head and neck themselves. But it's great. It helps repair the TMJ tissue, the function, it increases the collagen. Night laze is another feature. Basically what that's doing is airway management, so it's opening the airway. It's non-ablative, so you're not cutting or removing anything. You don't have to numb up for it. You pre-warm the soft palate. So some before and after pictures just to show you the results. What it's doing is it is tighten, toning, and lifting the soft palate. And it's doing that by stimulating the existing collagen and then helping create new collagen to support that lift. A couple other before and after pictures. Doctors charging anywhere from about $1,800 to $2,300 for the procedure. Typically it takes about 2 or 3 procedures, 21 days apart. 21 days because over that time period it's producing new collagen. Smooth laze is another feature. This is where it gets into a lot of the fun stuff for the aesthetic side. So you're strengthening the oral mucosa and you're eliminating wrinkles and lines. This is actually all done intraorally. So it's great for the patients who don't want to have any downtime. You can have this treatment done and go back to work the next day and nobody knows that you had anything done. Versus, the peels where you're going to see the redness, you may peel, you'll have some post-op healing from that. Lip laze is a nice alternative treatment than having to do the artificial fillers, the Juvederm, the Botox. So you're able to plump, again, you're producing new collagen. You're able to plump the lips with the laser. Just plump. Skin resurfacing. So this is an extraoral peel. So the next few slides are showing that, yes, you can do it intraorally, but you can also do it extraorally as well. In Florida, they're able to do extraorally. There's some states where you can't go past the Vermilion border, which is where the smooth lace comes in, but there are ways of making that work with a medical director. In these cases, this was done an external peel, so a facial peel. There's a few different, there's a light, medium, and heavy peel. It just kind of depends on the depth of wrinkles. It depends on the patient's desire and what they're wanting. Same with the neck. So dentists, your scope of practice is head and neck, so you're able to, once you give them that smile, give them the lips and the face to go with it, so you're able to tighten and tone the neck as well. Get rid of the double chin and the wrinkles along with it. Dark eyes or bags under the eyes is another feature you're able to do with the laser. So these are a couple before and after pictures of that. Again, these are services that you can implement to your practice that if you're not offering it, they're going to find someone else who is going to offer it. Varicose veins are very fast and easy. They're actually really fun to watch, because if you hit right on the blood supply, you watch the whole thing vanish right then. You can treat acne or acne scars with the laser. This is before and after, about 4 hours apart. Facial hair removal. And yes, men want these too. This one was actually all done intraorally, so you can see the bags under the eyes, and it was treated intraorally to reduce that. So the 2 lasers in one gives you the better value. Why choose the Lightwalker? Because you have 2 lasers in one machine. That enables you and your referring dentist to do more for your practice. That's it.